my pleasure to welcome you to the afternoon. And first of all, I would love to thank Slobodka for inviting me again. It's my second talk in this KYON series. And this talk will briefly summarize what we did in the first 6 years when we worked with darks. Then I switch over to what we did in the last 3 to 4 years. On this part, I really urge you not to take any photographs because I'm showing unpublished material. The curves are unpublished, the movies are unpublished, and so on and so on. I just decided that you're the community to show them. And I showed them once in Germany before, and so it's really, I'm kind of excited because I'm very, very curious on your reaction. Okay, so the Jena study of dogs in motion, this was a study of 327 dogs. We took 32 breeds and a bit more than 10 dogs per breed, and we were interested to find out whether there is breed-specific locomotion. To give you my background, by the way, I'm a zoologist and evolutionary biologist. I'm not a veterinarian. And so what we do comparative studies, and comparative studies among breeds is classical. Darwin would have loved to have this. And so all studies were on the same equipment. We took a treadmill of a horse, a very comfortable treadmill, and we used the marker system, and we used real-time movies. So here you could see one of these real-time movies. And so we are using normally 500 frames per second when we work with dogs. All dogs have been marked and then ran on this treadmill, as you can see in another Airedale. Guess what is my breed? And so this is the basis of what I will tell you in a minute. So marker-based data for 327 dogs, and this is how it looks like when an Airedale is running. Totally marked on both sides, just saw one side. And this is a fantastic database, but at the same time, whoever worked with markers knows that they are only partly reliable, because markers are glued to the skin. And so what we measure is not angular movement of the joint, but angular movement of the joints hidden under the skin. And the more skin you have, the less reliable are the data. So I most probably would not stand in front of you if we would not have had the chance, a bit more than 10 years ago, to get a unique equipment. It's still, and we're proud of it, the world's best equipment in this way. It's a biplanar fluoroscopy with which we can get up to 2,000 X-rays per second and up to 1,000 X-rays per second. We have HDTV quality, so the best quality you can access on this. And since a bit more than 10 years now, we took X-rays of close to 20 breeds. You see some of them here. And if the breeds are up to a size of 45 centimeters, we can have a whole animal. If they are small, if they are bigger, we have to work on different levels. So this is now, if you've never seen an X-ray of a running dog, this is 500 frames per second. And you easily see that the forelimb is moving perhaps differently than you ever thought. Look at the joints first, Look at the joints first. Look at the elbow joint and see how they are not moving during locomotion. So this dog is trotting at a relatively comfortable speed. Look at the shoulder joint, and you also see that touchdown and liftoff is almost the same. So forelimb movement is the result of scapular rotation and translation along the body. And if you go up here, you could even see the ear cartilages. This gives you an idea of the quality of our equipment. This is another animal, and on the outside you see the markers. And these markers, now we took So we have the X-ray and we have the marker system simultaneously. And this allows us to calculate the so-called systematic error of skin displacement on the joints. And by this, we can use, on the basis of X-ray movies, the more than 300 marker-based dogs, and finally come out with reliable data on their motion. We put all the different data sets together, and together with two young fellows, we did this. So this is what we call a heuristic scientific animation. We used the same software as Jurassic Park did, okay? But them invented locomotion, and we are documenting. It's just the contrary. It couldn't be more polar than these two axes. And each of the movements in here, if you look at the head movement, for example, this is a real trial. It's based on a dog moving, and it's not repeating. It's still going on, going on, going on. Everything we could learn about dogs is summarized in this, but again, only in the sagittal plane. And when we had these heuristic animations, they were, again, a tool for us to correct and to interfere with other data we had earlier. I just give you a few examples of this because the main part of my talk today should go on new data. These are skeletons which I found in the vet schools in Germany, and I guess if I would browse the vet schools in the States, it would be the same. Look at these skeletons, and look, I think most of you will have had a skeleton like this when he was studying anatomy, or this or this. Unfortunately, they are all wrong. None of the skeletons mounted so far in any vet school I've seen was right. What is the problem, actually? You see, I always put a horizontal red line, and the dogs were mounted in a way, actually they were urged in a way to be like this, that the hip joint is on the same level as the shoulder joint. Is this true? Follow the red dot. The red dot marks the crossing of the scapular spines. And by chance, we could not do this, it was just by chance, this dog was running through while he was walking on a treadmill. And you see that the red dot is absolutely coming out. It will take a pause now to make it a bit more thrilling. And now, no, not again, but you already get the impression that it will be on the hip joint. Okay, so the two pivots of a dog are the hip joint in the back when they use symmetrical gaits, just as pacing, walking, and trotting, and it will be on the upper level of the scapula in the forelimb. This is the pivot of the dog on the forelimb. So this is how a dog skeleton should be mounted. And if those people take picture who are teaching anatomy, this is the best thing you can do. Go back and make them. There's only one exception, one big exception, okay? All breeds are leveled like the ones I showed you before, except for the most famous, whatever, the German Shepherd. And actually, we found out that breeding German Shepherds is just for one reason went wrong. Because the idea of a German Shepherd is to make an ever longer step. And so that judges can see the very long step, you lower the hip joint. And the lower the hip joint is, look at me if I do this. This is an upright, and if I go down, I make longer steps. So you lower the hip joint, you have longer steps, but unfortunately, this is not very good. So let's go back to the scapula. This is a whippet, and this is the scapular movement of this pretty whippet. Okay, and you see that again, scapular spines are crossing now on the very superior border. And again, it's just sagittal plane. So what we do we map CT-based skeletons onto these X-rays to get an even better understanding. But then you need biplanar X-ray movies. And this is again something I've shown rarely before. You could see the exact movement of the shoulder joint. You see the scapula swinging forward. Now comes the humerus. Okay, touchdown, and the joint remains in position. The procedure we take, the method we are applying, is called X-ROMM, or scientific rotoscoping. This is a method many people used for years, but it has been formalized by Beth Brainerd and Stephen Gatesy from Brown University in 2010. You need X-ray, you need the reconstruction, and it's a non-invasive method, and you align by hand, manually, bones with this, and this will become more and more important during my talk. Okay, two more points. Look at this. This is why dogs move so harmoniously, because the thigh, the femur, and the scapula are absolutely in matched motion in a diagonal gait. And this is, again, the pivots. Then you draw a line from the pivots to the place where the foot is down. The angle here is called the angle of attack. This angle of attack is, for example, extremely stable in humans. It's 62 to 65 with a very low variation, not depending on sex, by the way. And you can see that in dogs, too, this angle is highly, highly accurate. You will find it in different breeds, and then you have one angle, and this is a low variability. The other point which is of importance is the so-called match motion of first and third limb segment. Look at this, and I try to get into it. Hind limb touchdown, and you see that the femur and the tarsometatarsus are aligned in parallel, and they remain in this position throughout the movement, and even during swing phase. And now we go to the forelimb. You see scapula, lower arm aligned, and it remains aligned. You can use this. From now on, nobody needs an X-ray equipment anymore, because you look on the lower arm and you get the position of the scapula with the reliability of less than 5-degree error. So you can really, when you see the lower arm, it's always matching with the movement of the scapula, and if you see the tarsometatarsus, it's as well matching. And this is also true in gallop. Okay, this is not changed by the gaits. It's the same. You see in here matched motion of the hind limbs, first and third segment, and of the forelimb. So if we look at this again, you see, okay, first and third element is aligned, and that it remains aligned, and that it only can move like this, but not like this. This has a reason. Okay, you can only move the limbs of a dog like this during locomotion when it's loaded. It cannot open the limbs. And the reason is that we have a three-segmented system, okay, like femur, tibia, and foot, and an additional fourth element. And these two elements in the middle, they are now isometric. So if the two middle segments have the same length, you can only move like this. This is mechanically otherwise impossible. So what is the fourth element now in dogs? Very simple. It's the long head of the triceps and the gastrocnemius muscles. These muscles, said to be extensors, are not at all extensors. The only time they are extensors are when your dog is lying on the back, stretching his arms and legs. Okay, this is the moment where they really act as extensors. And all of the rest of the time, they are not extending the limb, but they have a totally different loading principle. And this you can see when you look at the activity pattern. Since more than 40 years, in functional morphology, we call these muscles anti-gravity muscles. And if you look now at the activation period, you see that the triceps is activated at the beginning of the stance phase and not when the limb is stretching. When the limb is stretching at the end of the stance phase, it's the biceps being activated. And very simple, if this limb takes up load, it would fall down, but the fourth element, the triceps, is actually strengthening, and we know from very, very different studies, from different groups, that this activation pattern is for sure, and we also know that this muscle, the triceps and the gastrocnemius muscles, are only shortening to less than 5% during contraction. They are isometric. And you see the same pattern, it's exactly the same pattern in the hind limb. You see the gastrocnemius and so on, being active at the beginning till the mid or 2/3 and not more than this. And if we go now to another animation where we placed all the muscles, we did this with a lot of work. We cut the muscles 3D and so on. And you can see that the triceps, fires at the beginning of stance, and it ends firing in the moment the limb is stretched. And look at the gastrocnemius muscles, firing now, and it ends when the foot is extended. So it's against whatever you learned in anatomy or topographic anatomy. We published all of this in 2011 in German and in English. So everything you've heard and seen up to now, you can read, and in our book there's a DVD with all the X-ray movements and so on and so on. So this is the first part. Now we come to the new aspect. It took us years to finally find out what is the importance of 3D rotation. So last year in Zurich, it was actually the first attempt to show something, and now we get stronger on this. There's just one paper by Kim et al., published less than 2 years ago, and you see that using single-plane fluoroscopy, we demonstrated that normal in vivo joint kinematics in dog are complex. Okay, they are complex, and they will become even more complex in a minute. They used single-plane fluoroscopy, and in their paper they said, this is the best we could do with just one plane. Somebody who has 2 planes should do it better. Okay, this is what we did. You see the X-ray equipment, you see the marker equipment around. So why do we need the marker equipment? Because we need force-placed data and for inverse kinematics and inverse dynamics. And these force-plate data, it's extremely difficult to get them simultaneously with X-ray data, especially when you use a 4-split belt. So there is just one such belt available in Europe, and if the whippet, this was for the German television, normally the whippet has to move like this, that each foot is placed on a separate treadmill. And each treadmill is equipped with the force plate recordings. So we have the force plates of the 4 different limbs recorded separately, and then we can start calculating the rest. And the point what is new about it, then for kinematics, we will talk about French bulldog more and more. Look at this. In the first study, as almost all people, I think all people did so far, we placed the marker on the joints. Now we place the markers on the joints and the segments, and we use T markers. Simple. If you have just a sagittal plane, a normal marker is okay. But if you expect a rotation, if I make an abduction, this T marker will go like this and will shorten. So from the T marker's orientation, we can get data on abduction, adduction, and we get data on, and this is very important, long axis rotation. This means this kind of rotation, the long axis of the limb, how does it rotate during locomotion? The same bulldog comes here. Funny face. I think it's not so funny for this dog, actually, it just looks, unfortunately. And now you see the T markers on the humerus, and you see again that the skin is moving, even if we place them best possible. So the markers are placed under X-ray control. We do all the experiments on kinematics with the X-rays, and then the animal is transferred to the vet school in Hanover, where the treadmill data are get. Okay, so this is this. What is the result then? Sagittal plane motion from the side seems to be extremely similar. You have to look carefully to see that the orange scapula has a bit more of a tilting than the rest. 3D data now shows it differently. For all the diagrams coming, okay, we have the Whippet, Bulldog, and Malinois, so the French Shepherd, and you see 3 vertical lines. These 3 vertical lines indicate the lift-off moment of these normalized curves, okay? Bases are 5 dogs of each breed and a minimum of 25 trials per dog. And you can see that, okay, we have an abduction of the scapula, an adduction of the humerus, so this makes it equal, and this is almost nothing in the Malinois and in the Whippet, while there is a movement during swing in the French Bulldog. And now comes long axis rotation. The scapula rotates, if you take the maximum amplitude here, it's less than 10 degrees. But look at the humerus. The humerus of the French Bulldog starts by -20 and goes up to more than 20 degrees. So you have a long axis rotation of the humerus during each step of this degree. And from now on, I'm concentrating on the hind limb, okay? So curves for the pro and retraction, and you see again that the curves are extremely similar, just that the amplitude of the French Bulldog is lower. So from the side, for totally different, if you compare French Bulldog to a Whippet, and this is what we said till only 2 months ago, that dogs move extremely similar. They are. From the side, it's difficult to tell. And now comes the data for the hind limb. And this is of some concern, I think, for most of here in this room, and especially people having to do with knee joints. Because, look at this first. You have an abduction of the femur and a slight, and this is abduction and so on. But this is the point I wanted to come. This is external rotation of the femur. So during trot, you have an external rotation of the femur of 40 degrees in the French Bulldog. Do you know what this means? This means that this bone turns outward like this, long axis rotation. And you see at the same time that in the Whippet and in the Malinois, these long axis rotation are almost zero. So here we have a breed-specific component, and if you think who has cruciate ligament problems, you immediately do not think of a Whippet or of a Malinois, just to a lesser degree. So some movies on this. This is Malinois Schritt is walking and trot is Trab. And so compare the Malinois during walking with the Malinois during trotting, and you see that it takes the femur and here with the limb to the more and more sagittal plane. This is what we all know from trotting. Trotting means the legs are underneath the body, while walking is this, trotting is this. This is exactly what we found. This is the whippet. And the whippet is the pure energy saver. The whippet takes its hind and forelimb even stronger underneath the body because you have the center of gravity, and the closer you come to the center of gravity, the less you have side movements, and the less you have side movements, the lesser energy you need. So the whippet walk is really optimized. And if you compare the Malinois and the whippet, you see that during walking they are very similar, but not during trotting. You see the whippet, femur, and so on. And now comes the French bulldog. Okay, this is kind of difficult. And the nicest thing I can show you is this. Okay, the whippet goes to the inside, while during trotting, unfortunately, with higher speed and more weight on the limb, the French bulldog goes to the outside. And if we see them all four from the front, it looks like this. And you see that the French bulldog has really a silly walk. So the joke isn't a joke, but it cannot breathe, but it cannot walk either. And so it has the highest energy consumption during walking, while it cannot breathe. It's double handicapped. Okay? Here, the message is very simple. Three-dimensionally, breeds are specific, probably even individually. We find some differences between the 5 dogs per breed we have already. And this makes it more complicated. Think about the citation of Kim. It's a really complicated system, the stifle joint. It is more complicated because if you use implants or whatsoever, you should be demanded to consider which breed you are talking about. So now comes the bulldog you have seen before, and it shows you this is the method. We map the CT of the same bulldog onto its motion, and you see what during walking the femur is doing, how it turns to the outside. Look at the hip joint, an extreme abduction, long axis rotation, of course, due to the hip joint. And if we add the tibia, you can see that the tibia in the French bulldog is more or less taken with the femur. So it's not, in some of the breeds we found counterclockwise movement, external rotation and internal. In the French bulldog, they are moved to the outside, both of them. And this becomes even worse in the trot. Okay, to give you an impression, this is touchdown position, which seemed to be quite normal. And then I take the file, okay, touchdown, and now it starts to rotate so that you can almost see the patella at the end just before liftoff. That this is an enormous task for the ligaments. This is very clear, again, trotting with the tibia. So the stifle joint and the hip joint are under serious 3D kinematic loading. We are on the way to calculate also the torques. This is just the touch down and lift off position. And by measuring, if you want, everybody could do this. When you turn it, you just measure the distance here and the distance here, and you can get the angle. So what we also do, having forces, we are not only doing kinematics, this is the upper line, but torques. And in the first row here, torques are normalized to body weight, okay? A French bulldog is about a third of a Malinois. And it even becomes clearer if we normalize to body weight and to Withers height. Then you can see that during protraction and retraction, the three dogs behave, again, very similar. This is exactly what we had before. And now comes. Look at the torque. The poor French bulldog has to suffer, while the other ones have almost a zero torque during abduction. And look at the torque during long axis rotation. These torques, in a way, needs to be compensated by very different structures, and in the moment we are far from understanding what muscle group is causing which torque at this moment, and so on, because this is just the first time you and probably me ever thought these things. I just saw them like 8 weeks ago or 10 weeks ago for the first time. For the stifle joint, it means that, okay, I like this very much. It's from Daniel Koch, who is not with us this year. Daniel Koch, a Swiss vet. Daniel always says, this is where a veterinarian earns his money. The bigger the circle, the more interesting for the vet. Okay, you see, it's the knee you earn the money of, okay? And of course, it's especially the ligaments in the knee. And so it should be of some importance. The old idea of the stifle joint, I need not to explain, is the draw movement. And since 2-3 years, again by the work of Kim and others, another idea has already been introduced, and the new idea is that we have draw and rotation, and according to what I just said, the idea needs to be specified. We have draw and we have rotation in the knee joint to a very different extent in different breeds. So while a Whippet, you have almost just a draw motion, the French Bulldog is dominated by the rotation. And this is, if we go to the relative angles, it's not surprising then that the French Bulldog has the largest angle, and so on and so on. Okay. The 3D inverse dynamics of the forelimbs of a beagle, so this was the first study. After an enormously long time, the American Journal of Vet Research publishes it now. It took me a year. That is rare, at least in biology, to wait so long to get a publication. And this is normally the end of this talk, but this morning, Jean-Benoît Lefebvre, he presented facial data, and he actually, some of you have realized that I left immediately after his talk because I thought that I should share some more. Again, please do not photograph it. It's unpublished PhD stuff. We are on the way to work on fascia, because before I come to our own work, I would love to introduce you to my new hero, Jean-Claude Guimardot. He is the most exceptional. He's a surgeon, a hand surgeon in humans, so human medical doctor. And while working on the hand, he used his endoscope to make videos of connective tissue behavior, one could say, of very different layers. And these videos you can see on YouTube. So just note this Jean-Claude Guimardot. Go to YouTube and you will find videos you wouldn't expect to see before. All we do is nothing against his work. It's fantastic work. And he just published a book, Architecture of the Human Living Fascia. And Jean-Benoit was absolutely right. There's nothing on dogs. There's a bit on horses, and almost everything is on humans. So this 1.5 years ago, to me, was the final point to start with the PhD work. And what you see in here is the superficial fascia in a preparation. So this poor student, Irina Miszewski, she worked 4 months to this you can roll like a pullover, okay? It's just you can have it in the small bag. And it's this layer, all of us, me included, always cut away when we do anatomy. We wanted to go for the muscles. And between the skin here, this is the skin, this is the bone, and normally we cut away everything until we are to the muscles. But Guimberteau points out there is a continuity from the skin to the bone. And of course, we all know from developmental biology that bone is nothing else than calcified connective tissue. It's a continuity. To say that a tendon inserts on the bone shows that you have no idea of development, because there's a continuity of the bone via the tendon to the muscle during development. And it's just this part differentiating to muscles, this to tendon and this to bone. And it's the same from the skin to the bone. So you were, in my opinion, it was absolutely fascinating to see that when you cut less, there should be a difference. It's just a way of experimenting with this. Okay, so you were talking about the deep fascia, and this is the superficial fascia. Fascia is nothing else than stronger connective tissue, denser layers of connective tissue. It's not a known structure, okay? This is why Irina, by doing the preparation of this fascia superficialis, she had problem, of course, to say, okay, here we cut. It's arbitrary. It's a continuum where we take out this fascia, and fascia forms the body. You see the dog in this. Isn't that fascinating? Okay, last point. Then we said, okay, now we want to know better about facial structures. So we did an ultrasonography with a vet from Frankfurt all along the lines, all along these lines. And now we take off the squares below and work with histology on these things. And this goes like this. So the upper is ultrasonography and the lower is histology. And so to find out what are these dark gray, light gray, black, and white lines are, you need to have this histology, and then you can say, okay, there, for example, now there is a muscle, there is more muscle fibers, then there comes a fat body, and so on and so on. And this is what you, by working in a classical way, are supposed to cut. So what are fascias? The first definition of fascias, reminding that it's a continuity. First definition of fascias is this: sheaths, permeates, and so on and so on. Still, and this is what fascias are doing. They serve as power transmission, so the first function is mechanical function. They conduct lymph, and now it comes, and you were pointing to the proprioceptors. They possess the highest number of receptors, the highest number of any organ, and especially noci. And so they are responsible for pain. A lot of pain is not produced by muscles or muscular cells, how could they? But by the connective tissue or the fascias. And they have numerous free nervous endings, so the mobility depends on fascia. So if this is all right, Jean-Benoit should be right, that the more conservative he is working, the less you damage parts and the better the mobility should be. Thank you very much for your attention. It was a pleasure talking to you.